Well, good afternoon, everybody, and welcome to one of, I call it a necessary evil. We always talk about compliance being our friend. Taking a look at all the different rules and regulations that get changed on an annual basis, it can be a really challenge. And in fact, CMS has just finalized some of the new 2024 changes. And it's my privilege and my honor to introduce and bring back again for the umpteenth time, Mr. Chalen Jackson, who I use as an unbelievable reference. Chalen, I'll let you go ahead and kind of talk a little bit about, some of the things that we've read so far. I've not had a chance to go through all of what these finalized rules, but anyway, I'll let you take the floor.
Hey, Steve, always appreciate the opportunity to get in front of folks. Great to see a lot of folks again. Couple housekeeping notes. We do have that chat box, Q&A box there. Go ahead and toss questions in as you come up with them. I'll probably wait till the end to answer any of them, just because I may answer your questions naturally as I go along, but don't hesitate to toss a question in that chat box as we go. Kind of my guide for today is going to be this newly updated FAQ that Integrity just put out. So I'm sure you all get a post-Webby email with that resource in it. Going to be a little bit of review. So if you attended the last webinar, if you've been keeping up with, all the emails and stuff all over the place, a lot of it's going to be old hat for you, but are some critical updates and some changes that I think a lot of people will be glad to finally have some answers on. So just rolling into it, wanted to start a little bit with some of the questions I've been getting about TPMOs in general. So no changes to definition of a TPMO or who counts as a TPMO. Agents and brokers still TPMOs, still have to abide all these rules, in addition to any additional requirements a carrier may place on us. That's one of the big things I want to make note of, because you'll see that as a trend through some of these. Is you've got two masters, so to speak. You've got CMS that kind of sets down the basic guidelines, but you also have contracts with all of your carriers that you must abide by, so they can oftentimes put in place slightly different or even more restrictive regulations at the carrier level. So I'm going to go through the TPMO disclaimer first, because I think that's a big one that has gotten a lot of attention this year. First things first, and we're going to go into the numbers part a little bit later, but the disclaimer has changed just a little bit for this year. You may well know that you now have to add SHIPs, State Health Insurance Program, as an option for people to go for information on all their options. So also have to discuss the number of carriers, number of plans that you're representing in a client's given area. So just to give you an example, the full disclaimer now would be something along the lines of, we do not offer all plans available in your area, and the information we do provide is based on plans we do offer in your area. We currently represent X number of organizations offering Y number of plans in your area. For information on all of your options, please reach out to Medicare.gov, 1-800-Medicare, or your state health insurance program. So didn't really change the length significantly in terms of how long it takes to read this disclaimer, or how much room it takes up on a page. Not a huge difference there. Just a little more complicated. Still has to be on all marketing materials. This is another big point of confusion that I keep getting from agents and brokers. Marketing materials, not communications materials, not things that don't meet the CMS definition of marketing, not things that don't contain plan information, that don't contain marketing content and intent. So only marketing stuff. If it needs submitted to CMS, it needs the disclaimer. If it doesn't need to be submitted to CMS, it does not need the disclaimer. So definitely a kind of a cleaner way to think about it. If you got marketing pieces hanging around that haven't been reviewed by the team, go ahead and get those sent in so someone can take a look at them. Even if you think it's a communications piece, get a double check on that and make sure you're compliant for this AEP. In addition to marketing pieces, that TPMO disclaimer needs to be on your website, needs to be in your email footer, and it is still required to be on all of your first minute of all of your sales, marketing, and enrollment calls. So what's a sales marketing and enrollment call? There's a great, wonderful technical definition that CMS put out. But here's the way I tell every agent I speak to, the easiest way to think about it. If you need a scope to have the conversation, you need to record it, and you need to use the TPMO disclaimer. So if you're going to do anything related to talking benefits, talking plans, talking about enrollment or completing a telephonic enrollment, if you need a scope to have the conversation, you need to record it and you need to use the disclaimer. So that said, a couple specific rules regarding certain types of marketing pieces, especially things like TV ads or any type of video-based ad, even if it's online on YouTube, Facebook, anything video-based. If it does count as marketing content and does have to have the disclaimer, you definitely want to make sure that you're following these rules. TPMO disclaimer has to be in the same font size. If it's going to be on the screen, has to be in the same font size as the telephone number or contact info. If it is going to be read aloud, it has to be read at the same pace and cadence as the telephone number or other contact info, email, website, whatever. And if it's going to be on screen, again, font size requirement, but also has to be present for the entire ad. Can't just be flashed at the end. So need to make sure that disclaimer is in place. Print stuff, online stuff like websites or, text ads, things like that. We want to make sure that we are using a 12-point font or equivalent for that disclaimer. Obviously, there's going to be some variability for, mobile devices, iPads, desktops. There's going to be a little bit of variability there, but it needs to be coded to be 12-point font. So talk to your web designer, talk to whoever does your online stuff. If you're using something like Facebook ads, that's going to be kind of a default font size anyway, but definitely want to take a look at that. One last note on the TPMO disclaimer in terms of where you need it. One big thing that agents miss out on is this does apply to any electronic communications. So not just email, not just phone calls, not just Zoom and Ring Central meetings. If you're having a sales, marketing, or enrollment conversation via text message, you also need to use the TPMO disclaimer. So that is one that a lot of people were missing out on. But definitely want to talk a little bit about how do we calculate those numbers. X number of organizations, Y number of plans. What do we plug in there? Well, there's a couple different ways to go about it. On something like your website, your email signature goes out to a lot of different people, a lot of different places, may not know where that is when you start that conversation. Easiest thing to do is just kind of use the big number. Look at, I work in, let's say you work in 10 different states, you're contracted with 19 carriers, and in combined those 10 states, they offer 283 plans. None of those are real numbers. I made all of them up. But that's the numbers you should use on email and on your website. If you're talking about something like a direct mail piece or even a targeted Facebook ad or Google AdWords things, anything that is targeted to a specific geographic area, you want to make sure that you are using the numbers based on that particular geographic area. So you want to count up, I'm sending these different mailers out to these 9 zip codes. These 9 zip codes are in these 4 counties. You want to use the numbers based on where it's actually going. So definitely take a look at how you're calculating that. Phone calls, again, only need this disclaimer on sales, marketing, enrollment phone calls. You can't really get to a sales, marketing, or enrollment call without having collected a scope, without having already talked to this person to know where they're located. So you should be able to provide a good number on that TPMO disclaimer for that individual once you get to a sales, marketing, or enrollment call. And as I mentioned earlier, reminder about Zoom and Ring Central calls. If you're having sales or enrollment meetings over Zoom, Ring Central, some other kind of electronic video format, you do have to record those as well. You only have to keep the audio portion of the call, but you do need to record those as well and still use the disclaimers. And again, any type of electronic communication, whether it is text message, Facebook, Zoom, Ring Central, have that disclaimer there for any sales conversations, and then anything public facing, whether that's your website, your Facebook page, Instagram, whatever social media platforms, you need that TPMO disclaimer there as well. There, should be like an about section or a notes type section, just somewhere prominently displayed on that page that contains that disclaimer. Moving right along, and again, keep popping questions into the chat box there, the Q&A box, and we will get along to those as quickly as we can. But definitely want to make sure we're going through some of the critical elements here. So one last thing on calls. So again, sales, marketing, enrollment calls, that's what needs to be recorded. So what are some things that are not sales, marketing, and enrollment calls? Kind of anything that doesn't, again, like I said, if it doesn't require a scope to have the conversation, it doesn't have to be recorded. So if you are, for example, calling to make sure someone got their ID cards, calling to set an appointment. If someone calls in and says, hey, I need help finding a new rheumatologist or something else about their current plan, you don't need to record those calls, just sales, marketing, and enrollment. Next big thing that we've seen a lot of changes with this year are some kind of changes to beneficiary contact. How can we interact with Medicare beneficiaries? One of the biggest ones is business reply cards, lead cards, PTC, however you want to refer to it, some kind of permission to contact a beneficiary. Those are limited to 12 months. So if someone fills out a BRC, permission to contact, something like that, fills out a lead card, turns in a mailer, whatever it is, 12 months is the signature date from the signature date of the beneficiary or their initial request. If it wasn't something that had a signature, that is how long that permission to contact is valid for, unless they become a client, in which case you can reach out to them as a current client, or if they fill out a subsequent permission to contact. Now, the big caveat to that statement of it being good for 1 year, at any time, a beneficiary can request to opt out of that permission to contact. If someone says, don't call me anymore, put them on your internal do not call list. Don't call them anymore unless they subsequently opt in through a different mechanism. So that's definitely something to keep an eye on. Biggest thing with business reply cards, PTC, some changes this year to educational events. You can still collect business reply cards, permission to contact at an educational event. You cannot collect scopes of appointment, and you cannot set future date marketing appointments at that educational event. So PTC, business reply card only, you'll have to call those folks the next day and set up appointments, collect scopes at that time. But can't be setting appointments or collecting BRCs, or collecting scopes at an educational event. Business reply cards, PTC, absolutely okay. The other big changes to lead cards, again, lead card, BRC, PTC, we're going to kind of use all those interchangeably. If you have a valid lead card, it doesn't matter what product that lead card is for necessarily, but the interpretation from a lot of folks so far has been, hey, if you are knocking on someone's door because you have a MedSup lead card or with the intention to sell them a MedSup, you're fine, you're good, even if that conversation turns to Medicare Advantage. That's never really set super well with me. I've always said, hey, if you're in a market like St. Louis, Missouri, where 56% of people have Medicare Advantage, probably not a safe bet that you're really expecting to sell a Medicare supplement when you knock on that door. So with some clarification, even if you have a business reply card, a lead card for someone for Medicare Advantage or Part D, that does not constitute permission to go knock on their door without a preset appointment. It is a marketing violation to door knock for Medicare Advantage or PDP in any capacity, even with a lead card. You must have a preset appointment to approach a beneficiary's house. So that makes it pretty clear. Now, again, back to this debate of, well, what if I'm door knocking for MedSup or for ancillary or for whatever? Here's the deal. You are contracted with carriers that offer Medicare Advantage, and prescription drug plans. As such, you are subject to CMS rules. The interpretation right now is that if you are contracted to offer Medicare Advantage and PDP, you should not be door knocking for any products. So that kind of puts a bow on that one for a lot of people. Not that it's a time efficient mechanism of getting business anyway, or a particularly effective one in this day and age. Man, just stay safe out there, folks. I mean, I've back in the day when I was an agent, I used to knock on doors. It was never fun, and it was sometimes dangerous. So I never really recommended it to folks, but we do have a little more clear edict to not be doing that under any capacity from CMS. So going on to more information about contact. Let's talk about this requirement in the final rule for plans to provide an annual opt-out notice. So in the past, someone could opt out of contact from their plan for what they call plan business, which means other products that a plan offers. And people could provide that opt-out at any time. They could say, hey, don't contact me about plan business. Carriers were required to provide that notice once. So if someone enrolled and they stayed on the same plan or with the same carrier for 4 years, they only ever got that notice once. Now CMS is requiring that they have to, in writing on an annual basis, provide the form or some ability for people to opt out of communication for plan business. So what does that mean to you as an agent? Well, if someone fills out that opt-out for plan business, the carrier cannot contact them about other products the carrier offers or things like that. So not a huge difference for us, but that is something that clients may have questions about. There's some flexibility from CMS in terms of how plans provide that notice, in terms of as part of an enrollment kit or in welcome packets or as a separate letter altogether. So keep an eye out for those. And if you get client questions about this weird thing, now you'll know what it is. Moving on to scopes of appointment. Obviously, huge talking point this year for anyone who's been in the business longer than 5 or 6 years. The 48-hour rule is back for back with a vengeance. So let's talk 48-hour rule. Yes, you have to get a scope 48 hours prior to conducting a marketing appointment or completing an enrollment. And someone has already popped in some Humana language into the chat. So here's what we're going to talk about. There are two, depending on who you ask, three, but there are two primary exceptions. One, the exception to the 48-hour rule is for someone who is in the last 4 days of a valid election period. This is more complicated than you think. It seems pretty easy. So AEP, we're talking about the 4th, 5th, 6th, and 7th of December. If someone is in that time frame, you collect the scope immediately. 48-hour rule is waived. You sign them up, no issue. Biggest thing is, even if someone's in one of these exception categories, you still have to get a scope. You just don't have to wait 48 hours. So keep an eye out for that. Second exception, walk-in appointments. This is where all the controversy comes in. When the rule was originally passed, and in the Code of Federal Regulations, 42 CFR 422, Section 2264, it says very specifically in-person walk-in appointment. However, what we've heard from several carriers, what we have heard from CMS, indirectly through some different conduits, is that they were also going to consider unsolicited inbound phone calls as a walk-in. At this point in time, and again, I mentioned at the very beginning, you've got CMS and you've got your carrier contractual obligations. Several carriers have indicated that they consider an inbound phone call an exemption to the 48-hour rule. So if someone does call in unsolicited, not, hey, if you call me back, this counts as an inbound phone call and I don't have to wait 48 hours, not going to work. Unsolicited inbound phone call, you do not have to wait 48 hours. You still have to get a scope. If you look at some of the scopes that are coming out in your app kits that you're probably getting delivered right about now, if you did your pre-orders and got your search done early, you'll probably notice that many of them have that inbound call exception listed on the scope. So keep an eye out for that. Now, the caveat to all of this, to clarify and make it just plain language for everybody. Right now, today, I am saying, Integrity is saying, most carriers are saying explicitly, inbound calls are exempt from the 48-hour rule. CMS could always choose to throw a wrench in that by issuing some sub-regulatory guidance at any point in the future. But right now, today, that is what we are going with. But back to the 4 days. Last 4 days of an enrollment period. Easy to say last 4 days of AEP. What about last 4 days of OEP? Well, okay. Enrollment period, not the last 4 days of a month. So only the last 4 days of March. 28, 29, 30, 31 of March. Not the last 4 days of February, not the last 4 days of January. The client's proposed effective date does not necessarily preclude them from that 48-hour rule. It has to be the last 4 days of the election period, not just 4 days before their desired effective date. So that's a big thing to keep an eye on, because a lot of election periods last more than 1 month. So just to be clear on that. Another thing, 48 hours. How literally do you interpret 48 hours? Very literally. If you're using any kind of electronic or voice recorded scope options, be knowledgeable and cognizant of the fact that if I take a scope at 4 p.m. on a Tuesday, I cannot meet with that client for a sales appointment until 4 p.m. on Thursday or later. 48 hours, not 2 calendar days. So keep an eye on that. I see a ton of questions coming in, and I love it so much. Keep putting those in there, and I will go back through them at the end if I don't happen to answer them throughout this process anyway. So a few big questions I've been getting. Does the 48-hour rule apply to telephonic sales, call centers, so on and so forth? The answer is yes. They get all of the same exceptions that you do. They get all the same rules that you do. So they do have to do the 48-hour rule for any outbounds. If they have true inbound calls, they would have the exact same exemption that you do for true inbound calls. Lots of confusion about that, but they're not exempt. It does apply to call centers and telephonic agents. One of the big questions I've gotten, though, is what if you make, say, an outbound call to someone and leave a voicemail and they call you back? Does that count as an inbound? No, it does not, because it's not an unsolicited inbound call. You solicited that person. The 48-hour rule would apply. Scopes are good for 12 months. A lot of people don't realize this, but technically before that, they really didn't go bad. I mean, a lot of folks tell you anywhere from 14 days to 90 days to it was good for the election period it was signed for. But if you read the statutes, until right now today, actually next week, scopes were good pretty much forever. But starting 9/30, and again, implementation for pretty much all of this is 9/30. Valid for 12 months. So here's the deal. You want to get around the 48-hour rule? Here's what you do. You meet with your clients during AEP or whenever, even folks that you meet with tomorrow. The last thing they do before they leave your office is fill out another scope for their next appointment. Streamline this process for yourself. Make it a little bit easier. Already went over a little bit the changes to educational events. We cannot collect those, collect scopes at educational events. Has to be BRCs or permission to contacts. Also on educational events, cannot hold a sales event, including a personal marketing appointment, within 12 hours of an educational event at the same location. So can't have any steak dinner educational events. And then at the end, you get up and announce, okay, we're going to take a 15-minute break. We're going to come back. We're going to have coffee and pie and have a sales event. Can't be doing that anymore. That was kind of the genesis of that type of rule. Had a couple kind of 1% of 1% questions. Two agents cannot conspire to have educational and sales events in the same location, just set up by different agents. Two competing agents that are not associated can't necessarily inadvertently cause each other to be out of compliance either, though. So if you have Joe down the road and you both have events at the same library. One's a sales event, one's an educational event. You're not in the same agency, you're competitors. You can't inadvertently cause each other to be out of compliance, but you can't coordinate with anyone to do that either. Couple last things regarding personal appointments with beneficiaries. Have to do a couple new things this year. CMS has come up with a list of topics and questions called, okay, I'm going to address this one right now because it's in all caps and George is real excited, which I super appreciate. What's the difference between a BRC and a permission to contact? Functionally nothing. It's just whichever language you like to use. Business reply card, permission to contact, BRC, PTC, they both serve the exact same function to get you the ability to call somebody about their Medicare products. So I'll address that one now just because. But personal appointments. In addition to everything we've always done in the past, CMS added a requirement for what they call elements required prior to enrollment. This is a list of questions regarding their plan, regarding, kind of how that plan is going to affect them, what questions they have. Really, the easiest way to think of this is it's kind of a CMS required fact finder. It's going to be questions about doctors, about drugs, about health concerns, all these things that should go into every plan presentation and should be used to help establish whether or not someone's a plan is a good fit for somebody. Also, we do have some changes to the pre-enrollment checklist, both in form and function. Pre-enrollment checklists have been part of app kits for ages and ages. It's the type of thing that says, hey, you're on this type of plan, an HMO, a PPO, you do have copays. If you go outside the network, you will maybe not have coverage or you may pay more depending on the type of plan. There are required things on that pre-enrollment checklist. One of the things that got added this year was a new element called effect on current coverage. So this new element on the pre-enrollment checklist is some model language that basically says you as the agent have to explain to the beneficiary what is going to happen to any current coverage they have once they enroll in this new plan. So for example, if they're currently enrolled in a Medicare Advantage plan and you're switching them to a new one, you're required to mention to them, hey, your current coverage will end on this date. Your new coverage will start on this date, and it will be totally replacing that coverage. But that's pretty easy. That's pretty simple. What the real concern here is folks that have some form of other coverage. For example, TRICARE, VA benefits, federal employee benefits, Indian Health Service, Medicaid. You're going to be required to disclose how the plan you're enrolling someone into is going to affect that coverage. For example, you enroll someone who has TRICARE for life into a Medicare Advantage plan that includes drug coverage. Well, Mr. Jones, since you're enrolling into this plan that does have drug coverage, you won't be able to use meds by mail through TRICARE anymore. You may face copays and coinsurances for some of your drugs. You are going to have to use your plan's network of providers. If you go outside of the network, TRICARE may not pick up the difference. You're going to have to explain those types of things to people if you're enrolling them in a plan. If you're doing any kind of telephonic enrollments, you are required to line item that pre-enrollment checklist and get an affirmative response from the client that they have heard and understood it. If you are meeting face-to-face or in person, you just have to provide a copy of that pre-enrollment checklist with the app. And again, it's part of the app kit. So don't hunt around and look for some kind of standardized form or anything like that. It's part of every app kit. So moving into, that's kind of the last part of that, moving into marketing, third-party marketing submissions, and getting marketing materials approved. I know we already talked real briefly about that, but there are some changes for this year. Obviously, anything that contains marketing content has to be submitted to CMS, has to be submitted to carriers first. That is a change. So any carrier that you represent, even if you don't have carrier names, logos, or anything like that on a marketing piece, if it contains marketing content, any carrier you plan to represent with that marketing piece has to pre-approve the content of that marketing piece so that by the time it gets to HPMS, the health plan management system that CMS operates, you have clean copy. Back in the day, we used to submit things, and CMS and the carriers would, maybe argue back and forth a little bit, make these changes, no, make these changes. It took up a lot of bandwidth. CMS has said, no, carriers, you all duke it out before it ever gets to us. We want clean copy that you have all agreed to. That way, by the time it actually gets to CMS, they can do the CMS review, rubber stamp it, and you're good to go. Now, that's a process that can still take between 5 and 45 days, depending on the type of marketing piece that you're producing and how many revisions it takes. Because again, you're representing 10 carriers, you send it out to all 10, 9 of them come back, but one says, well, change this, this, and this. You make those changes. You still have to send it back out to all 10 of them because it's not the same piece that the other 9 originally approved. So you can see how that can cause a lot of issues. So, adding to that, a lot of this is stuff that you as an agent day to day aren't going to have to deal with. Agents generally cannot get direct access to the health plan management system or to the CMS submission tools. Have to go through your upline. So again, anything that is client facing that you're putting together, get someone to take a look at. Make sure it does not meet the definition of marketing and doesn't need to be submitted. Or if it does, we can walk you through that process. 3 kind of primary changes to marketing materials this year. One being can't market benefits in an area they're not available. This one's common sense. It's something that should be seen as a pretty big win for agents. This is directly targeting and painting a big red X on every Joe Namath, JJ Walker, William Shatner, all those TV ads that we saw all last year that market a $144 give back that's only available in 2 counties in Florida, but they're marketing it here in the Midwest, or some other absurdly large benefit, $20,000 in dental that's only available in like 4 counties here in Missouri and Illinois. So again, market benefits that are actually available where you're marketing. So what does that mean for us? A lot more locally focused advertising on those TV ads. They'll be a little more tailored to the local area, probably. Does not for a minute mean that those are going to stop necessarily. It just means that they'll probably get a little more targeted. If you're going to mention any products, plans, benefits, or costs, this includes generic stuff like $0 premiums may be available. This includes generic things like dental, vision, and hearing, any kind of benefits. You have to list the names of the carriers offering those benefits, which does turn that into a marketing piece. We used to be able to market on a generic basis a lot of these benefits that were commonly available, dental, vision, hearing being a very good example. We used to be able to market those on communications pieces. We could say generically, dental, vision, hearing is available on a lot of plans, and that was communications, did not have to go through the approval process. No longer the case. We now have to list what carrier is offering those benefits, what the dollar amount is associated with it, and has to go through the approval process. Last thing on this is you cannot market benefits that are not actually benefits, basically. You can't market based on comparisons to an uninsured individual. So you can't tell someone, hey, you could save, thousands of dollars on your Medicare Part B premiums when you're really comparing them just to someone who has Medicaid versus doesn't have Medicaid. Things that are not actually dependent on plan choice. You may have seen in the past TV ads or other ads that say things like, save $5,000 on your drug costs. Well, that's the comparison to someone who has no Part D coverage. So we can only market things that are actually based on deciding to enroll in a specific plan, not based on comparisons to someone that is uninsured or unpaid costs of dual eligible beneficiaries, things like that. Back to some of those carrier names and things like that. If you are marketing any kind of benefits and have to have carrier names on there, again, 12-point font. Can't have those names or disclaimers in tiny unreadable font. Need that in a good 12-point font. And again, TV ads, online videos, anything video based has to be in the same font size as the phone number, contact information, or any benefits that you're advertising, and has to be there the whole thing. So, biggest takeaway here, if you are buying leads, you need to make sure that one of two things is true. If they're using marketing content, you need to make sure that it's approved, that it has that SMID from CMS. Reach out to your carrier reps or your upline to say, hey, can you help verify that this is a legit marketing piece, that it's been approved, or that they're using generic pieces that are not marketing, they're communications, and don't need to be submitted. But it is on you as an agent to know where your leads come from and how they're being generated, and making sure that the person you're buying from is following all of the rules. You can, so in terms of generic, you can still generically list product types. So for example, merely saying I offer Medicare Advantage plans, Medicare supplement plans, and prescription drug plans, that alone does not constitute marketing content. So you can still provide communications pieces like that. One of the biggest issues with these is that, so let's say you take out an ad in the local newspaper and it is a marketing piece. Well, there's some kind of reasonable and unavoidable exceptions to these rules. So only marketing benefits in an area they're available. Well, a reasonable exception to that is you've got a newspaper ad out, and there's no way for you to know that someone who grew up in your hometown, but now they've moved to New York City, and they still subscribe to the local paper by mail. There's no way for you to know, predict, or prevent that. So that is a reasonable exception to that particular rule. Billboards, generally not considered national media. So even though someone could be from anywhere driving along the interstate looking at a billboard, generally the local area that billboard is located in is going to be the defining moment for what is permitted to be on that billboard. Again, even if you're marketing benefits such as gym memberships, dental coverage, hearing coverage, you still have to reference carriers, dollar amounts, things like that. All right. And again, keep tossing questions in there. I keep seeing some hop in, so that is fantastic. We'll go through as many of those as we can. Definitely want to make sure that anytime you're using any kind of superlative or descriptive language, best, worst, biggest, smallest, things like that, you can't use any of that language unless you can factually back it up with data less than one plan year old. So even things like you may see a carrier marketing largest network or most popular plan in this zip code, they can still do that. They just have to be able to back it up with data from at least the most recent plan year. And just a quick note that carriers can, of course, deny marketing pieces if they have compliance concerns. And so let's say you've got 10 carriers, 9 of them approve a marketing piece. One of them says, yeah, we don't like it. There's no changes you can make. We don't want our plans marketed with that. You cannot market their plans with that particular marketing piece if they go that route. So some changes to communications, primarily to the use of the Medicare name, marks, and logos. Big questions here. We cannot, under any circumstances, use the Medicare name, marks, or logos in a misleading manner. What is misleading? Of course, that can be debated ad nauseum, but a couple specific examples from the final rule. There have been, using Medicare in the name of a storefront where they could assume that the storefront is affiliated with CMS or a Medicare program. Medicare notices on postcards, TV ads, or Medicare is in large font, or Medicare notice, something like that, large bold letters. And then any disclaimers or information are small, and they could assume that it's coming from Medicare or a federal program. Similarly, anything, and again, a lot of these things that have been prohibited for a long time, but CMS is strengthening the rules a little bit. Anything that's intended to look like a government document or official notice, so things like personal and confidential, important Medicare information, boxes listing customer IDs, and things like that. So anything that makes it look like something that could come from the government could make it non-compliant. Biggest thing is if you have the word Medicare in your agency name, in your marketing, in your website URL, it is highly recommended that you begin the process of making a change. So again, websites, names, emails. If Medicare is a part of how you market to clients right now, the word Medicare, you should be examining a change. Right now, there is not a 100% outright. It's still in a misleading manner. But as CMS continues to strengthen what they consider a misleading manner, and based on some of the examples provided already, it is highly recommended that you start the transition. And again, I'm not telling you today, but I would say start a plan now, so that next year you can begin to transition your agency away from that use of the word Medicare in an agency name, URL, or email. Because again, come December, CMS will put out another round, and we'll have a whole new set of rules to look at for next year. Going through that CMS logo or information that appears to be from the federal government, we need to avoid anything like that. Need to avoid anything that looks like it could be from the government. And the big one, the Medicare card. You cannot use the Medicare card image in any communications or marketing materials without the express written permission of CMS. There is a process in place to get that permission. So again, if you have anything that uses the Medicare card that is not already an approved federal document, like for example, an app kit that has a Medicare card in it so folks know where to find their MBI, or the Medicare and You handbook as published by CMS, something you created, if it has the Medicare card on it, you do need to go through that approval process, send that to your upline to get that approval started. It can take a couple weeks, so make sure you plan ahead. All right. Going on through some of the, again, superlatives in logos and taglines. So whether that's your best, fast, worst, biggest, things like that, or the use of Medicare itself in logos and taglines, cannot use unsubstantiated superlatives in logos, taglines, or anything like that. Even if you have some kind of disclaimer or something like that, if you can't support or back up any superlatives, best, worst, biggest, fastest, smallest, slowest, whatever, cannot use those. Similarly, using the Medicare name, marks, and logos, even in a tagline, it's getting dicier and dicier. So again, the clarification point is that if you're using it in a misleading manner. So again, if you were to use Medicare, for example, in a tagline, or in your logo somewhere, you would be required in the same font size to have a non-government entity right there under and amongst that tagline or logo. So again, right now today, you could probably still do something like a tagline, but there's a lot of concerns over that. Last thing I want to address is carrier oversight, because there are a lot of changes there. And I'm starting to hear some things from fellow compliance officers, from some of the carriers, that I would tell anyone who's watching this and going, I think I can get around some of these things. Pay attention. Carriers are already doing oversight. Carriers are required now by CMS mandate to create a more robust and proactive compliance program, which includes things like random audits. I've already heard from several people that a number of carriers are planning to do random scope of appointment checks. So we haven't had to send those in with the app for several years for a lot of carriers. We just have to keep them on file. But I know of several carriers that are planning to pull a percentage of apps at random. Reach out to those agents and you'll have 48 hours to produce the scope of appointment. So know what you're doing and how to get access to those. In addition, plan on a lot more secret shopping this year. Carriers are going to be doing it. CMS is still going to be doing it. Definitely want to keep an eye out for that secret shopping, and also be super clear. Secret shopping is not what you think it might be anymore. It is not just little old ladies going to your educational events or your sales events and making sure you don't slip up and say the wrong thing. The vast majority of secret shopping now is a call center full of people Googling Medicare keywords and finding every Google ad and Facebook page and calling phone numbers on TV commercials to see what licensed agent ends up on the other end of the phone and determining whether or not they're doing anything incorrect. So be cautious. Again, if you're buying leads, you want to make sure you're buying them from compliant sources and verifying, how compliant those processes are. And we'll talk about that for just half a second. If you're buying leads, you need to know, in my mind, primarily three things. One, do they offshore any of their services? Because any offshoring of any part of the process needs to be disclosed to Medicare through your carrier partners. But that's something to be knowledgeable of. Two, will they show you their collateral, their ads, their websites, their URLs, their whatever is causing that client to click or call or whatever? You need to be able to see that. And then you also need to see a copy of the script that that team uses. For example, if you're getting like warm transfers, they're getting those calls from somewhere, either compliant outbound calls from lead pages or inbound calls from ads. We'll assume that part's compliant since we already talked about that. But so they're getting those calls. They have a phone script. You need a copy of that script to make sure that they're not making any promises that you can't keep. So definitely keep an eye on that. With that, there again, definitely a chance that CMS could put out some additional compliance guidance between now and the 15th of October. You all may remember a couple of years ago on the 8th of October, they put out a memo with some updated compliance info, and it changed the game a little bit. But right now, today, what we're going over is kind of our rule book for this AEP. And I'm going to start going through questions. If you have more questions, please go ahead and pop them in there. And I'm going to go way back up to the top and kind of do this top to bottom. Pam's asking about the TPMO disclaimer on social media and electronic media. Yes, if it meets the definition of marketing for, say, a TV ad or some other electronic media, yes, you are required to have that there. And again, Facebook pages, Instagram pages, anything that serves functionally the same capacity as a website, you want to make sure that TPMO disclaimer is there also. Tony is asking for websites. Nope, it's somewhere. For websites, is there somewhere to find how many plans are available in each state by carrier, since the number varies by county? There's a couple good places to do that. Both of them are going to take some work. CSG Actuarial, the probably most well known for its MedSup quote engine, but they have a tool built into that can help you determine based on like a single area, like you punch in a zip code, and it'll help you determine how many plans are in that particular zip code and or county. The kind of broader way to do it for, say, a website where you're trying to come up with that big number. I'm licensed in 10 states with 27 carriers. Easiest thing is going to be to use the CMS landscape. So that should be coming out here in the next week. It came out September 29th last year. But it's these massive Excel spreadsheets. There's 3 of them, one for MA plans, one for special needs plans, one's for PDPs. And that lists every plan from every carrier, county by county, all across the U.S. Just make sure you're not doubling up too much. You want to count those H numbers, not, because, for example, HO169 is a popular DSNP plan here in Missouri and Iowa. It's available in a total of like 130 counties between the 2 states. You don't want to count that as 130. That's one plan for those for all of those counties. So if I was looking at the state of Missouri, it would be easy to say, oh, this is 97 plans, but it's just one. Let's see. Pam's asking, so with a signed opt-out form, can a carrier solicit their current Part D clients to change to their MAPD plan? Pam, that is a fantastic and wonderful question, and I'm glad you caught on to the important part of that opt-out for plan business. The answer is no. If someone opts out of plan business, that carrier cannot solicit their clients to move them over to a Medicare Advantage plan. Now, I would caveat that with a couple of things. One being, if someone, it means they would not be able to do any outreach to that client for that purpose. If a client calls the carrier, for example, calls member services, has questions, it doesn't mean they couldn't eventually end up with a salesperson and in a different plan. It just means that the carriers can't proactively reach out regarding plan business. Kathleen just posted some scope information from Humana. Looks like pretty much a rehash of what we went over with that. Let's see. Yeah, just again, 48-hour rule. Every carrier is interpreting it just slightly differently at times. So keep an eye out. But again, right now, today, inbound calls, unprompted, unplanned inbound calls do not require the 48-hour wait. Lou is asking about educational group events for seniors on final expense. After the event, I have attendees fill out a registration card to enter for a free gift or drawing. Can I have the same registration card to include the following optional? If you would like to be contacted by an agent, schedule a call for your Medicare options. Please sign and date below. Would the optional verbiage be CMS compliant? Lou, on that one, I'm going to say two things. One, I would need to see the exact lead card you're talking about just to look at the language and see if it would need any additional disclaimers. You potentially could have that. I would recommend having that as two separate opt-ins. Just because it gets a little messy when we start talking about final expense in relation to Medicare plans. Obviously, we can't present both at the same appointment. Not on the, final expense is not on the scope. So I would recommend maybe having a couple different opt-ins because you never know. Someone may not care about final expense, but they might want to talk about their Medicare plan and vice versa. Pam saying some carriers are indicating kiosks and tables staffed by agents require a 48-hour scope, which makes no sense. I agree, Pam. If you're at a registered sales event, I would clarify that. So what do we mean by kiosks and tables? If you are at a registered sales event, you can collect the scope and take an enrollment immediately. That has not changed. I think, we do have some agents that try to do like educational kiosks. So a health fair or a community event, something like that. In that case, yes, absolutely. 48-hour rule still applies. But if you're at a registered sales event, you can absolutely take scope snaps immediately. Carol asking if we have a warm call lead transfer, we need a scope, but not 48 hours. Carol, that is going to depend on how those transfers are being generated. If those are true inbound calls. So for example, your lead vendor is running Facebook ads and the call to action is somebody calls in and they talk to a screening person, that screening person live transfers to you. That is an actual inbound call and you don't need the 48 hours. You do still need a scope. But for example, if it's someone running Facebook ads where the call to action is fill out this lead form, that screening person calls that person outbound and then transfers it to you, that is not an inbound call. And you do have to wait the 48 hours. So again, know where your leads are coming from and how they're being generated. Because if you're ever investigated or audited by a carrier, number one thing they will ask for is how did you come into contact with this person? And don't think it stops with you. You will be asked for proof of that permission to contact, and they'll say, this sounds like a long warm transfer. Where'd it come from? Send me the call before that. So you will get asked for that. Great question, Carol. Pam is saying one large carrier is using a lead generating company to cold call and then transferring those calls as inbound to their call center and considering these exempt from the 48-hour rule. Pam, you've got my number. Give me a call and let's talk about that. I'm not aware of anyone actively doing that currently. But again, right now, today, that's not an issue. Give me a shout after this, Pam, and we'll be happy to talk about that. Maria, if they come in for the sales presentation and don't purchase at that moment, can you use the same SOA for the second visit if it's within 12 months? So I believe, and Maria, tell me if I'm wrong, but I believe you're asking about like an in-person, or even if it's not in person, but an individual marketing appointment, not like a registered sales meeting. So name of the game is you need a new scope for every appointment. But again, last thing someone does before they leave your office is fill out a new scope. It doesn't matter if you made the sale or didn't make the sale. before you leave that person. Oh, I mean, it doesn't matter, over the phone, on a Zoom meeting, or in person, whatever it is. Last thing you do before you leave, they fill out the scope for the next visit. So go ahead and get that next scope. Again, good for 12 months or until you use them. And using a scope means using it to present a plan, whether you enroll them or not. Ann's asking, how is the 4-day rule when they turn 65? Again, great question, Ann. That's where it does get tricky. That 4-day exception does only apply to the last 4 days of the enrollment period. So that's 7 month of IEP, not the last 4 days of any given month throughout their IEP. So good question. Good point. Lalitha is asking, what if we're on an outbound call and get the client to agree to a Zoom meeting and then provide them with your plan enroll Pearl so the client can enroll themselves with your assistance? There's a couple issues there, Lalitha. Plan enroll Pearls are intended to be unassisted enrollments. If you are assisting the client, plan enroll is not the proper tool to use for that enrollment. Lots of other ways to conduct enrollments, but plan enroll, the Pearl there, is designed to be an unassisted enrollment. Regardless, you're probably going to need a scope for that process. So get the scope, get that 48-hour window gone through. But again, if you're guiding this process and assisting them in selecting a plan, plan enroll Pearl is not the appropriate tool for that job. Anne is asking, are 2023 scope forms good for 2024? For now, yes. Again, scopes are good for 12 months. So any scopes you're collecting right now today are good for the next 12 months. However, I would caveat that with the new scope forms are starting to come out as we get app kits and PDFs for 2024 apps. So, for example, we keep a generic scope on our website for anyone to grab if they need one. We will be updating that to a 2024 scope as soon as we get a hold of one that's generic enough for our liking. Biggest reason being, those new updated scopes do have additional language about the 48-hour rule and what exception applies. So again, if you've collected a scope already, they're still good for 12 months. But once we get those 2024s, you're going to want that as soon as you can. Lou is asking, don't know if you mentioned this, but say you have X number of carriers you're ready to sell. Do I have to mention all those carriers during a Medicare enrollment, or is it I have to mention all the different carrier plans I'm certified to sell in that beneficiary zip code? So you don't have to mention any of them by name, but in the disclaimer, you will have to indicate the number of carriers you offer and the number of plans they offer in your area. So in that person's area. And again, we talked a little bit about how to determine that number, like for your website versus a marketing piece versus by the time you get to the beneficiary level and you're having a marketing appointment. Yes, it would be down to their zip code. So you're licensed with and ready to sell with 21 plans, or 21 carriers, but only 6 of them offer plans in that beneficiary zip code. You want to use that smaller number since it is specific to that beneficiary at that point. Someone who is an anonymous attendee had a question about the scope. It's only good for 48 hours. I can get the scope on Monday. Can I meet with them on Friday? Or does it need to be within the 48 hours? I think you have it a little bit backwards. So the scope is good for 12 months. The 48-hour rule indicates that you must wait at least 48 hours before meeting with that client again to present and enroll in a plan. So definitely fantastic clarification and question. But yeah, so the 48 hours is the minimum between the scope signature and you being able to enroll them in a plan. Carol, still not sure how to calculate the number of plans. You're in 10 states with 21 carriers. Hey, sounds like a great start. You've got 21 carriers. Pop into the either CSG or the landscapes, see how many plans those carriers offer in those 10 states. And again, if you're doing any marketing, narrow it down to where that marketing is being sent to. And I guess the big thing I would ask, mention to folks will be like, well, I'm sending out ANOC letters to my clients and it's a marketing piece. So I need the disclaimer. but I've got clients in 10 states. Well, that's fantastic. You're going to have to send out multiple versions of that letter or marketing piece to make sure you're not marketing benefits in an area they're not available, and to make sure you have that appropriate disclaimer. Dennis is asking, has there been a change in offering and selling a hospital indemnity plan during an MAPD appointment? No, Dennis, there has not. You can still offer any products listed on the scope of appointment. If you've been to any of the Medicare Center trainings recently, you'll notice that the Medicare Center scope, as well as a couple of the other generic scopes out there, specify only additional health products rather than specifically hospital indemnity and dental. So maybe use that Medicare scope if you want a little more leeway in what health products you offer, things like that. But I know we will be having some more trainings on Medicare Center soon once they get some crazy and cool new updates for this AEP active and up and running. Marissa asking about, does this apply to email addresses? Can you have Medicare at? Again, nothing that would be confusing or misleading to a beneficiary that might indicate to that beneficiary that you are somehow connected with, endorsed by, or working for the federal Medicare program. Right now, today, it's still a little bit of a gray area. What I typically recommend to folks is if you're using the term Medicare, you need to use a qualifier such as Medicare plans, Medicare insurance, something that clarifies that you were talking about insurance products related to Medicare and not the federal program itself. But even that, I think, is kind of a stopgap. The biggest thing is just next year. Have a plan to maybe transition away from that altogether. Lawanda is asking, can you say you specialize in Medicare on your business card? Kind of the same rules. It's a little bit gray right now. I would never, here's what I'd tell folks right now today. And again, I expect this will change and kind of the noose will tighten over the next couple of years. Right now today, never use the word Medicare by itself. Medicare plans, Medicare insurance, Medicare products, some kind of qualifier that indicates that you are talking about insurance, not the federal program by itself. Never use the word Medicare alone. Marin is asking about the use of the word Medicare in a tagline. Using the tagline Medicare Solutions. So we already talked a little bit about taglines, Marin. Hopefully that was helpful. Again, a little bit gray-ish. If you want to use the tagline Medicare Solutions under your business name, I would, again, never use the word Medicare by itself. Medicare Plan Solutions, Medicare Insurance Solutions, something like that. And again, if you're using the word Medicare, you must have that a non-government entity disclaimer right underneath that in the exact same font size. So clarify that if you can, and you should be okay, at least for now. Lou is asking if I had a disclaimer in my website in which it would say basically that this site is not a part of CMS, would that be CMS compliant? Kind of like your earlier question, Lou, about the PTC or BRC, would have to see the website, would have to see specifically what that looks like, would want to do a full compliance review of it, certainly to make sure it has any disclaimers that are required. But, just adding a disclaimer doesn't mean we can flaunt the rules, I mean, you wouldn't be able to, start printing off $100 bills and just say this is fake and still try to pass it off at the store. So, it's kind of the same thing here. Just having a disclaimer is not necessarily sufficient to be compliant. We would need to review that website to make sure you're meeting all the requirements. I think we've kind of covered this. PAM Master form transfers from a lead company are considered inbound. Again, going to depend on the particular company and how they're generating those warm transfers. If they're, inbound from the get-go based on a, call to action from a compliant TV or online or, even a mail card, if it was truly inbound from the get-go, then yes, it would be inbound. But again, that comes down to talk to your lead vendors and make sure where everything is coming from and how those are being generated. Chris said, good presentation. Thank you, Chris. I appreciate you being here. I really, really do. Pam also said, doing a great job. I really appreciate that as well. Chris is asking, will we be able to get the script and collateral for leads purchased through Lead Center? That's a fantastic question for Lead Center. I'm not personally involved in that particular project, but I know those vendors do go through a pretty heavy vetting process to end up on Lead Center. If you have a contact there, I would for sure reach out to them about anything that you're needing regarding those leads. And Chris is asking, plan enroll leads are considered inbound calls. Correct. In general, Chris, if it's the ones I'm thinking of, then yes, those would be. Someone's on plan enroll and it says, hey, would you like to talk to a live agent? Call now. Yes, that would be an inbound call. Oh, wait, Pam said ignore her last question. Well, I addressed it anyway, so we're in good shape. Anonymous attendee again asking, or it could be a different anonymous attendee, I don't know. So if someone walks into the office and gives you a zip code, you first look up that zip code on whatever tool you suggested and then give them the exact number of offered plans for that area. No, that'd be kind of silly and a little pedantic of you, I think. I mean, it's not necessary to do that just because someone walks in your office. Again, the TPMO, first of all, never required in person. If you're meeting with someone in person, you don't have to rattle off that disclaimer. That has never been the case. It's never been required in person. But also, just speaking to someone does not constitute a sales, marketing, or enrollment call. So it does not necessarily mean you would need the disclaimer. Again, disclaimer is necessary and call recording is necessary if you would normally need a scope of appointment to have that conversation. Disclaimer is not necessary until you start discussing plans, benefits, or enrollment. So if you need a scope, you need the disclaimer, vice versa. Hopefully that helps. How do you complete a carrier's e-scope that asks for the date appointment completed when you don't know when the appointment will be? Obviously, it has to be minimum 48 hours in the future, but what if you don't know? Does CMS need that specific date? Thank you. Shannon, that is a fantastic question. Use a different scope platform is my recommendation. It's kind of a glitch in the system. Not a glitch so much, but it's just the way those are kind of coded to require all fields to be filled. But again, you're absolutely right. You don't always know when that appointment's going to be completed. It really, that section doesn't necessarily have to be filled out until you do have that appointment. And then that date of appointment is in the agent portion of the scope that you should be filling out and signing. So if the carrier's e-scope platform does not accommodate that, use a different e-scope. Use Medicare Center, use a different carrier's e-scope. Because again, a scope is a scope is a scope. You do a Humana scope, it's fine if you end up enrolling that person in UHC after the meeting. Whatever works for you all. Carol's asking, does New Horizons review websites for compliance? And if so, will that satisfy all of the carriers you rep? Carol, I guess I won't speak for Steve, but in general, yes, your upline will be able to review websites for compliance. Now, as far as if something requires carrier submission, for example, if it contains marketing content and needs to go through CMS approval, or if it has carrier logos on it, which again, for anyone using carrier logos on your website, you are required to get written permission from the carrier to use those logos on your website. And typically, they require you to renew that permission every year, or if you make substantive design changes to the website that could change how that brand is represented. So for anything you have contracted through New Horizons, they can definitely help with that submission process for sure. So it would be for anything you have contracted with them. They couldn't necessarily submit it to a carrier on your behalf for something you don't have with them. But another great reason to work with Steve and the team at New Horizons. Lou says, awesome information. I appreciate that, Lou. And N is asking, review the meds for clients who call me to check and see if med and drugstore is still in their current plan. Do I need a scope for this or only if it turns into a sales situation? So it sounds like you're talking a little bit about kind of like an ANOC type thing. If you are discussing plan benefits, you need a scope. Get it ahead of time. Why wouldn't you? Otherwise, you're going to do all that work to review the plan, and then you're going to have to wait 48 hours. So get those meds, get those doctors, get whatever you need to do that review during that 48 hours. Get the scope, collect all that information, 48 hours minimum later, you're ready to go, whether they need to stay on the plan or don't. But yes, if you're discussing plan benefits, you need a scope. Maria is saying, thank you. You are the best. Is that okay to say? Hey, I tell you what, I've got some folks that can back that up with just, insurmountable evidence. So we'll allow that superlative in this particular case. Knowledge and ability to educate others is always appreciated. Maria, I truly appreciate that compliment. I really, really do. An anonymous attendee asking, is a referral from an existing client considered an inbound call? That would depend on whether they called you or not. Of course, even if someone says, hey, my friend Gertrude wants to talk to you about their insurance, unless you have a valid permission to contact, which their friend saying they want to talk to you is not permission to contact, you would not be able to call them. So yes, if a referral from an existing client called you, that would be an inbound call, and the 48-hour rule would not apply. Carol saying, I understand we don't have to record the appointment setting call. That is correct. You do not have to record calls for appointment setting, service, helping with new ID cards, helping them determine benefits on their current plan during the plan year when you're not anticipating making a change. So, you don't have to record any of those calls where they say, hey, my primary doctor says I really need to see a rheumatologist. Can you help me find one that's in network? Or, hey, I really need help figuring out this flex card thing. Or what dentists can I go to on my current plan? That kind of stuff you do not need to record. Anne is asking, I love this question so much. To talk to a non-senior power of attorney for the client, do I need a scope to talk to the power of attorney? Yes. Anyone who is going to be making the decision or signing the app, which if you've got a POA, presumably that's the case, even if that person specifically is not Medicare eligible, you do need a scope to talk to that decision maker or whoever is going to sign the app. So fantastic question, Ann. But yes, you would need to get the scope on that parent or POA at that point. Chris having a bit of a laugh, and Carol saying thanks for all the info and willingness to answer questions. Absolutely. Really appreciate everyone hopping on. You've got a couple more minutes. I'll stick around as long as I need to, but that wraps up the questions I can see in front of me. So please get them in if you do have anything else. Otherwise, Steve, I think we're kind of wrapping up.
Chalen, I think I want to apologize to everybody out there. I'll try to find somebody next time that's got a little bit better information. No, I'm absolutely.
Yeah, absolutely.
Yeah. I tell you what, I think everybody in the audience understands why we rely on you, and you're an incredible integrity asset, one that we all greatly appreciate. Again, I get to answer a certain percentage of all these compliance questions that I'm fairly familiar with, but the ones that fall between the cracks, you can see that Chalen is one of my favorite assets that we get to go to answer some of these questions. We get into some great discussions. Because again, I just want to say also that everybody's going to be getting a copy of this with the recording. Yeah, everybody's going to be getting a copy of this. It will be attached to the recording email that we're going to send out probably, Jason, the next 24 hours. Is that correct? About the next 24 hours or so. I've been through it briefly just once. I will tell you what you can read in one page. It looks like it gets contradicted in the next page. Don't read too much into it. It's a frequently asked questions, and they're usually unique to those certain specifics. So anyway, we appreciate everybody being on. Have we got one more question that we need to get taken care of from Anonymous?
Yep. Anonymous is saying they do some fact finding for all their referral clients that call in to us for help. On that call, we collect address, date of birth, med, doctors, etc. We don't discuss plan options. We do this to set an appointment with an agent at a later date. Does that call need to be recorded? To set that appointment and collect that information, not necessarily, but I would caution you that even though that initiated as an inbound call from someone who called in and said, hey, Gertrude referred me to you, if you're setting up a future appointment with that person, make sure you're collecting that scope, because that is no longer an inbound call once you hang up that phone. It doesn't matter if it started as an inbound call, you hang up the phone and have to call them back for that appointment, or they come in for that appointment. The 48-hour rule will apply, and you need to make sure you're also collecting a scope as a part of that process if you're setting up those later date appointments. Hopefully that makes sense.
Chalen, we're going to bring it to an end with that, my friend. You've done well. Really appreciate everything. Again, everybody, look for the attachment that's going to be coming on the recording. Everybody will get it that signed up for the webinar, and we appreciate absolute everybody. Chalen, thank you so very much. Have a great day, everybody.
Hey, thanks so much, everyone. We'll see y'all soon.